Buoy Health Insights, Drooping Eyelid. Hello and welcome to Buoy Health Insights. If you've been noticing one or both of your eyelids starting to droop, you might be dealing with a condition known as ptosis, commonly referred to as drooping eyelid. This condition can be quite irritating and concerning, as it can lead to changes in the appearance of your face and even impair your vision if it becomes severe. In today's episode, we'll delve into the potential causes of drooping eyelids, accompanying symptoms that might suggest specific underlying conditions, and when you should seek immediate medical care. Let's get started! Firstly, it's important to understand that drooping eyelids can either be congenital, which means present from birth, or develop later in life. The onset can be gradual or rapid, depending on the cause. If you're experiencing a drooping eyelid, you may also be experiencing other symptoms like having a small pupil and lack of sweating, an unusually large pupil, difficulty moving the eye, headaches, muscle weakness, blurred vision, or discomfort in the eye such as pain, itching, or discharge. So, what causes drooping eyelid? Well, it can arise from a variety of conditions. Let's talk about a few. Neurological conditions. Damage to peripheral nerves that control eyelid movement can be a culprit, perhaps resulting from an injury to an artery in the neck or pressure from a tumor. This might also present with a constricted pupil and lack of sweating. Moreover, decreased blood flow like what occurs during a stroke or pressure from an aneurysm or brain tumor could also lead to ptosis. Muscular conditions. Sometimes the communication between your nerves and muscles can get disrupted due to an immune response, leading to muscle weakness that includes the muscles. Lifting your eyelids. Or, as you age, the muscles and structures that hold up your eyelids might naturally degenerate. Eye or eyelid conditions. Infections or structural abnormalities like tumors or thickening from allergies can weigh down the eyelid, causing it to droop. Underlying medical conditions. Diabetes can damage small blood vessels that supply nerves controlling eyelid motion. Headache syndromes or thyroid diseases like hyperthyroidism or Graves' disease might also indirectly lead to eyelid drooping. Now, there are specific conditions like myasthenia gravis, an autoimmune disease where the immune system attacks the connection between nerves and muscles, that often result in drooping eyelids. This condition needs immediate medical attention given its potential to significantly impact muscle control. If you're dealing with a sudden onset of drooping eyelids, accompanied by symptoms such as weakness, numbness, slurred speech, abnormal vision, or a severe headache, you might be experiencing a stroke or transient ischemic attack, also known as a TIA or mini-stroke. This is a medical emergency, and you should seek help immediately by calling emergency services or heading to the hospital. In less severe cases like a sty, chemosis, eye irritation that causes swelling, or blepharitis, an infection at the base of the eyelashes, while uncomfortable, treatment can often be managed with hygiene, topical antibiotics, and over-the-counter remedies. However, if there is no improvement with self-care, it's best to consult a healthcare provider. And this concludes today's insight on drooping eyelids. Remember, while in many cases ptosis is not a sign of a serious issue, you should be mindful of the accompanying symptoms mentioned earlier. If you experience any of them, along with the drooping of your eyelid, it's advisable to reach out to a healthcare professional for a thorough evaluation. Thank you for joining me on Buoy Health Insights. If you found this information helpful, please like and subscribe for more health-related content. Until next time, take care!